We know that mammography saves lives. Mammography has been studied like no other test in all of medicine, and if women get screened starting at age 40 every year, we'll see a 40% reduction in mortality. If we can find breast cancers at stage 0 and stage 1, women have an over 95% chance of cure. It also allows for less invasive surgery and less toxic chemotherapy. So we're offering personalized breast cancer screening at all Rush sites, including Rush University Medical Center, our South Loop campus, our Oak Brook campus, Rush Oak Park Hospital, and Rush Copley Medical Center. So when the patient comes for her yearly mammogram, our technologist will ask them if they want to participate in the risk assessment program. And if they do, they give us their consent, and the technologist will ask them a series of questions. Then we'll also feed in information into Epic, our electronic health record. This information is then put through a cancer risk assessment software program, and then we receive back information on multiple risk models that give us the patient's lifetime risk of breast cancer.
I think one of the biggest reasons that Rush was looking to start a program like this was just because we knew that we were missing a lot of women that are considered high risk but just weren't getting into the appropriate providers.
We're using two factors to offer patients a personalized screening experience. One is breast density. If the patient has dense breasts on the mammogram, we're offering the patients additional screening. If they're not high risk, we offer them screening breast ultrasound, and what we use here is called ABUS, Automated Breast Ultrasound. ABUS is a wonderful technology where we scan the entire breast with ultrasound, and then we get three-dimensional reconstructions of the breast. This way, the radiologist is able to evaluate the entire breast using these ultrasound images. The program here at Rush has been very successful in finding small, invasive breast cancers. When patients meet these high-risk criteria, our nurse navigator will contact the patient. The patient will also get a letter from us, but they will definitely also get a phone call from our nurse navigator. She'll explain what the results show, and then she'll also call their clinician to see if it's okay for her to refer them to our high-risk clinic. This really sets us apart.
When we do identify patients at higher risk for breast cancer, we are able to successfully navigate them into a high-risk breast clinic and give them the either preventive treatments that might prevent them from getting breast cancer in the first place, as well as provide them the additional screening that would help us detect their breast cancer early if they're at higher risk.
We're one of the only academic centers in Illinois that uses this high-risk information and ties it to a high-risk clinic so that these patients are managed by experts in breast disease.
We're really helping patients to understand this information. But the whole goal of our program, whether it's patients being seen by genetic counselors or other providers in the high-risk program, is really helping them to understand what goes into that risk number and what are we going to do about it, whether it's additional screening, risk-reducing medications. In some situations, we even talk about risk-reducing surgeries. Those are definitely scary things to talk about. So we really want to make sure that patients are understanding what goes into that. It's all about making informed decisions for our patients with this information.
Rush is an excellent place for women to have their breast imaging. This is because only experts read and perform all breast imaging exams at Rush. All physicians who are breast imagers at Rush are completely specialized in breast imaging and have been doing this for multiple years. Rush also offers the newest technology available for screening, including multiple supplemental screening modalities. We have the latest 3D tomosynthesis imaging. We use a wide-angle tomosynthesis machine, which we think is best for finding small breast cancers. So it significantly changes the treatment options when we find cancers at those early stages.